Now, let's quickly go over the standalone bow tie Next Gen NCLEX practice question with me, Coach Candace RN. All right, so if you're looking to try to pass the NCLEX your next time around, then spend some time at my stand store where I have plenty of resources to help you with that test. All right, so here we go now. We're going to jump right into this standalone bow tie question where the nurse is in the outpatient laparoscopy clinic caring for a 49-year-old female client. All right. This client's name is Christine Lynn. She is a 49-year-old female, and the procedure is outpatient lap cholecystectomy, right? She's getting an outpatient lap chole. She's post-op 8 hours post anesthesia, and her past medical history is non-significant. Now, her code status is a full code. All right, here's some nurses' notes for you to check out there. All right, what are the assessment findings? Well, the patient last voided pre-op at 9 a.m. The patient received 1,800 milliliters of IV fluids intra, all right, or during, and post-op. Okay, so intra and post-op. All right, the patient reports lower abdominal pressure and the bladder feels full. Okay, we're unable to void despite warm water technique and the upright position. And then we've ambulated once with assistance since this surgery. All right. And then, or yeah, the lap chole. The abdomen is distended and the suprapubic fullness has been noted. All right. Do you know what suprapubic means? If you don't, it's okay. If you do, though, put in the comments and share to help out those of your fellow nurse candidates who may not know what that means. Okay, what is suprapubic? All right, share that in the comments. Pain, 3 out of 10 at the surgical site. What are the current orders? All right, well, we're going to do put PO fluids as tolerated. All right, um, as tolerated. We're going to ambulate this patient with assistance. All right, look at what we've got here. We've got PRN, acetaminophen, hydrocodone, or 5-325 in that formulation. All right, also known as something. Feel free to put that in the comments if you are past farm already. All right, so that's PO, Q6 hours PRN. All right, we can also void before discharge. That's something that needs to happen as one of the orders for this patient. And then finally, discharge criteria checklist is in progress. All right, so that's a little piece of information. That said, what are our instructions here? Check them out. They're always indicated with a little chevron on your NCLEX, a little right-facing arrow. So always notice that your instructions or your specific question or item instructions will be here right after that little chevron. So what are they for the standalone bow tie question? What are they? Complete the diagram by dragging from the choices below to specify what condition, here, indicated here, all right. The client is most likely experiencing two actions to take, all right, and two parameters to monitor. Okay, so we're going to use this. This is why it's called a bow tie, because once we finish clicking and dragging into the spots indicating the condition, most likely experiencing, the action to take over here on the left side here, and the parameters to monitor on the right side, that it'll make a nice little bow tie looking thing there. All right, so very clever, right? Okay, so let's now move on. Check out those vital signs. All right. See what information you can get from that tab. All right. And then we're going to start making some choices. All right. So always we should look first at the condition most likely experiencing. All right. It's kind of the anchor of the bow tie, that middle area there where both are connected, both little wings there are connected. So let's start there and then we'll know what actions to take and which parameters to monitor. All right. So first let's look at the condition. Now I've made it so that you can see the choices more clearly here. All right, so conditions. We only need to select one. Are we looking at constipation? This is what you're asking yourself, and we're going to, in the next screen, take a look at the answer. All right, and we're looking at this condition here. Is it constipation? cystitis, post-operative urinary retention, or pain-induced urinary inhibition. All right. Which of the four there are we going to go with, given the information we have there in the electronic medical record on the left? All right. Those nurses' notes, those vital signs point to which of these conditions. All right. Let's move on to the correct response. All right. If you went with postoperative urinary retention, then you're right. All right. Now let's move on to the next piece. Well, not before we take a little look at an animation that we created here so that you can see what it might feel like on the actual NCLEX. I don't know. You would drag, all right, from that little location here. You go with postoperative urinary retention and relocate it with a little click and drag there to the middle of the bow tie. All right. And I do believe these colors kind of approximate what those NCLEX colors look like as well. You can go to the NCSBN website and take a look at a little practice module that they have there, done by Pearson VUE, which is the company that makes the software for the NCLEX. All right. But there's a click and drag opportunity for you with this question. This question looks really fancy, but you only get 1 point. So you have to get all 5 segments of this question correct to get the 1 point for this question. So keep that in mind as you work with it. All right, so we're going to do that same thing for actions to take. All right, there are 2 actions to take here. All right, and which ones are you going to do? Are you going to A, perform a bladder scan and notify the provider? That second choice there is notify the healthcare provider. All right. The third one is encourage voiding and prepare for straight cath. And then the fourth one is administer diuretic. And your fifth choice there is withhold all PO fluids. All right. Which actions are you going to take? Now, you can pause the screen to think about the questions as they are laid out there. I know there's a little redundancy in those first two there, but hey, you're gonna make your choices. You're gonna make your choices accordingly. And then we'll come back and we will provide those correct answers for you. All right. So starting here, did you go with perform bladder scan and notify the provider? Yes, that is the correct action to take, right? And then also we have encourage voiding and prepare for straight cath. All right. Now, why didn't we go with notify the healthcare provider? Well, outside of context, we aren't just going to notify the healthcare provider, and we haven't tried a few things. We always want to do that on the NCLEX before just merely going off to notify the provider. All right. And we don't want to administer a diuretic. All right, put in the comments for me why you wouldn't want to administer a diuretic at this point. And then tell me why you also would not want to withhold all PO fluids. All right, throw those in the comments for me as well. All right, so let's move on. Those are our those were our potential conditions. Now we're going to look at our actions to take. Which 2 actions to take? That's our little animation that we have there. Did we go for? We went for perform bladder scan and notify the provider, and we went for encourage voiding and prepare for straight cath. Okay? All right. So time to move on to parameters to monitor. All right. So which 2 parameters to monitor are we going to check out here? In this case, you have the choice to have a bladder scan volume and output post void monitored. All right. So the volume of the bladder scan and the output post void. All right. Are those parameters you want to monitor? All right. Pain level and abdominal distension. Would you want to monitor that? Right? What about blood pressure trends? Do you want to monitor that in this patient? Okay. White blood cell count or WBC count. Is that going to be essential here? And then finally, incentive spirometry. Is that a parameter that you would like to monitor with that patient? Okay. All right. What did you go for? Correct response coming here, bladder, scan, volume, and output, post void. Yeah, definitely want to monitor that. That's going to let us know how this retention issue is going. All right. And then also, yeah, we want to keep an eye on that pain level. We knew it to be 3 out of 10 before. Let's just keep an eye on it. We don't want it to get greater than that. It could be an indication of some things going wrong. And then abdominal distension. Yeah, that could be another indication that we're retaining and not able to void. All right. Did you make those two choices? All right. Well, here's our little animation, right? All right. And you'll have the option to drag and drop the bladder scan volume and output post void option into its proper place in the first parameter to monitor. And then that second one may not have made the animation finals. Oh, well, there you go. Pain level and abdominal distension. That choice belongs there as the final choice in our standalone bow tie question. All right, so quick review for you to remember here. As we move forward, I want you to remember urinary retention and urinary hesitancy. It is a complication that will come in the post-operative environment, but also may come in other environments. Let's take a quick look at a few details that might help you moving forward, thinking about urinary retention. All right. If it's going to happen in the perioperative environment, it's usually going to happen immediately 2, 3 days post-op. All right. It's caused by an obstruction of the urethra and it puts the patient at risk for hydronephrosis. Do you know what that is? All right. If you do not, right, that gives you some place to start your active learning, your review, your NCLEX review. Do you have a notebook? All right. If you don't, check out my stand store. We do have an uh, it's an NCLEX study planner, and it will help you with kind of cataloging all this information so you can hold it somewhere and have it for future review, kind of fill in the blanks for the items that you don't have yet. All right. That said, the acute or chronic etiology or cause of urinary retention might be edema, BPH. What's BPH? Throw that in the comments. Tumor, inflammation, all right, being in the post anesthesia stage. Okay, stroke is a possibility as a reason for one to have urinary retention. Now, what does it look like clinically? All right, what are the manifestations? Well, the patient might be unable to void, all right, or inability to void might be a part of the notes. Bladder distension, all right, meaning, that the bladder is somehow expanded. All right, or the abdomen itself might show that the bladder appears to be distended or kind of poking out. All right, what about restlessness? Restlessness in certain types of patients, perhaps your patients who are obtunded or patients who are immobile, patients who may have um, uh, quadriplegia or possibly paraplegia, right? What interventions are we then going to do for those patients who have urinary retention? Now, we could help by positioning the patient upright, all right? Having them in Trendelenburg or having them lying on their back may, be working against gravity in this case. All right, relax the patient. Perhaps they need some privacy so that they can go, right? Perhaps they're having hesitancy and they actually need to be a bit more relaxed. We could do the hands in warm water technique, right? Where we put the fingertips in some warm water. A bladder scan may be necessary for this patient to see just how much, what volume of fluid is in there, right? Possibly letting us know where that blockage is occurring. All right, ensuring adequate fluid intake. All right, there could be an issue there with just PO intake. Offer the patient a bed plan. I's and O's. What is an I and O? Put that in the chat for me if you don't know. If you do know, put it in the chat for me. For those who don't know, right, might find it helpful. I think most of us know I's and O's, but it depends on where you are. If you're about to take the NCLEX, though, I would hope you know. All right. No shame, though. That's why we're sharing. All right. Administer bethonocol chloride. All right. That's one of the medications that one might take for urinary retention. Okay, we like to use, even if we don't know how to pronounce it very well, we're going to use the generic terms whenever we possibly can, all right, because the NCLEX doesn't deal in trade names, all right, they deal in generic terms only. All right, so with that said, there's an image of a bladder scan, all right, if you were to need to know what one of those looks like, all right, it kind of like an ultra scan, kind of. All right. Well, thank you for your time. And you are welcome to join me at my live Zoom sessions in my Stand store at stand.store, Coach Candace RN. Okay. Subscribe here for more or subscribe to the store where I will see you live. Okay. Take care.